The 25 outpatient centers of the Spaulding Rehabilitation Network around New England not only provide the best in sports rehabilitation, but some of the centers specialize in injuries from specific sports, like Spaulding's cycling medicine program in Wellesley. The program is led by Dr. Dana Kotler and physical therapist Greg Robidoux, both competitive cyclists themselves.
The individual that walks in our door, they sit down and we get a great kind of comprehensive understanding of who they are as a cyclist or triathlete. And a lot of that drives what we're going to do with them on the bike.
There's really no program like this that we know of. The fact that you have a full medical evaluation and a full PT evaluation that are happening not only simultaneously and side by side, but really collaboratively with the hope of creating a comprehensive plan, that just doesn't exist elsewhere. I think that's something that we really offer that's really unique.
Dana has a background in dance, but as she pursued her medical career, she became interested in cycling.
I started to ride with people that did some amateur bike racing, and they said, come ride with us, come race. And I said, I'm not fast enough to do that. But it ended up being a really supportive community, especially of women cyclists and women racers. Came back to Massachusetts to do my sports medicine fellowship at Harvard, got involved with the Harvard Cycling Association, and really got to know the cycling community here. I do a mix of road and cyclocross.
Greg was already a physical therapist when he started competitive racing.
I was racing and really enjoying that, and my teammates and then eventually other friends and other people that I didn't know would start approaching me saying, hey, you're a PT, right? And I would say, yeah. And they said, well, I've got this pain or that pain. And eventually I had a cycling medicine practice of my own. And I didn't have enough support to be able to develop it at a level that I wanted to. And I approached Dana and approached Spaulding, and they were 100% on board from day one.
We came up with this idea of a collaborative evaluation where someone's not seeing a doctor who's looking at one set of things, a physical therapist who's looking at one set of things, and then a bike fitter who's looking at one set of things.
On this day, they are seeing a new patient. He is Dimitri Pankratov, a professional cyclist from Uzbekistan. He races for Team Novo Nordisk, a team made up of all type 1 diabetics.
A lot of guys have a lot of aches and pains and they kind of work their way through it. But early on this year, he really started to get this disabling back pain. Dana and Greg have been longtime colleagues, and I really respected the work that they were doing, and I understood that this wasn't just something that a regular fitter could be able to do.
If you're trying to change the way the body moves, that's like learning to play a musical instrument. That takes effort, it takes someone teaching you how to do it, and it takes practice. With Dimitri, this is going to be a start of a longer process.
He's been compensating for problems for so long that we're going to have to undo a lot of things that have been going on for a while.
He's going to be somebody that's going to work at a very high level and is very demanding of what we can do for him. But what is really exciting sometimes is dealing with people who are commuters or people that do the PMC. They're the folks that we can educate the most, and that's one of the biggest things that people get out of this clinic.
Alex Carlton has been an athlete her whole life, but 6 years ago she began to participate in triathlons.
The reason I came to Spaulding and learned about the cyclomedicine, I wasn't at the point where I couldn't do my sports, but I was chronically uncomfortable. I was having a lot of discomfort in my hamstring. Where I was sitting, I was really uncomfortable, and then my lower back was hurting, and sort of everything sort of started to fall apart.
We took the full history, both of us looking at different aspects, what kinds of things tend to bring on pain, what kinds of things tend to be better tolerated.
Using ultrasound, she sort of looked at the hip area and my hamstring area where I was experiencing the problems, and she did some tests to test like how strong my left and my right was compared to each other. I was wildly unbalanced. That gave her some indications of areas that maybe Greg would want to look at.
The interesting thing about a bicycle is that you can be positioned horribly, and that may not show up for 2 or 3 seasons of riding. Because it's a no impact and it's a non-weight bearing sport, your body can just take it for quite a long time until it can't anymore. And the hard part for the athlete is that they don't identify that as the root cause. And so if we've got somebody like Alex who's going to go back to competition, we want to accommodate to begin with to allow that person to have the ability to ride their bike with less pain. And then they go through a physical therapy process where we work on their deficits. And then as we get through towards the end of that physical therapy process, we may then make some further adjustments more towards the side of performance for that person.
I needed to put a different insert into my shoe to keep my foot from collapsing, and that actually kind of put my body into the right position. So I felt less discomfort when I would ride from a very quick fix in one area. Some of the muscle imbalances, that took a little bit longer.
Alex also received advice on training and was given techniques that are now part of her daily routine.
There are people who can work with you and they can look at your body and they will get you back on the road and you'll be riding comfortably again. And people are almost amazed, like they've never heard that. I feel amazing. I can go fast and I can get off and run. It's made a huge difference.
When we come back, the Celebrity Spotlight Series travels to Cape Cod to see how Spaulding has been helping aging athletes continue to compete.